In the field of pediatric epilepsy, we've been fortunate to see the timetable for diagnosing Dravet syndrome shorten dramatically in recent years. Earlier diagnosis allows us to start effective Dravet-specific treatment, which can really help patients and their families from a seizure reduction standpoint. I consider DIACOMIT an early treatment option for seizure management in Dravet. It has a track record of efficacy that supports treating some of these more worrisome seizures that we see in patients with Dravet syndrome.
DIACOMIT is the only FDA-approved anti-seizure medication developed specifically to treat seizures associated with Dravet syndrome in children as young as 6 months, 15 pounds or more, and taking clobazam. In 2 multi-center randomized double-blind placebo-controlled trials, 58.1% of patients with Dravet syndrome experienced a 75% or greater reduction in clonic or tonic-clonic seizures, with 38.7% becoming seizure-free.
By minimizing prolonged convulsive seizures, we can help families avoid frequent, unplanned hospital visits that can have a negative effect on their daily life. One of my patients with Dravet syndrome was going to the ED every 4 to 6 weeks for clusters of prolonged convulsive seizures. Despite the other medications he was on, he was still having convulsive seizures. So, when he was of age, we began treating him with DIACOMIT and saw a significant improvement. Since he started DIACOMIT, we've been able to decrease their prolonged seizures substantially and minimize the family's visits to the emergency room, which is huge. The other thing I would say is with better seizure control, we've been able to reduce his total medication burden by tapering off 1 background medication and reducing the doses of 2 others. With fewer seizures, he's been able to get back into his school program and therapy sessions. In terms of side effects, DIACOMIT has been well tolerated by this patient. He experienced some tiredness, but with minor tweaks to his background medicines, we've been able to minimize the side effect profile.
The most common adverse reactions for patients taking DIACOMIT are somnolence, decreased appetite, agitation, ataxia, decreased weight, hypotonia, nausea, tremor, dysarthria, and insomnia.
DIACOMIT is something I consider early on for patients with Dravet syndrome because we have very robust data to support its efficacy and inform prescribers how to properly dose. When considering treatment options for your patient with Dravet, start with one that is backed by decades of clinical experience and real-world results. I'd say start with DIACOMIT.
To learn more about DIACOMIT, visit diacomit.com/HCP. Indication: DIACOMIT steripental is indicated for the treatment of seizures associated with Dravet syndrome in patients taking clobazam who are 6 months of age and older and weighing 7 kilograms or more. There are no clinical data to support the use of DIACOMIT as monotherapy in Dravet syndrome. Important safety information: contraindications, none. Warnings and precautions: somnolence. DIACOMIT can cause somnolence. Monitor patients for somnolence, particularly when DIACOMIT is used concomitantly with other CNS depressants or clobazam, which is also known to cause somnolence. Decreased appetite and decreased weight. DIACOMIT can cause decreases in appetite and weight. The growth and weight of pediatric patients treated with DIACOMIT should be carefully monitored. Neutropenia and thrombocytopenia. DIACOMIT can cause significant declines in neutrophil and platelet counts. Hematologic testing should be obtained prior to starting treatment with DIACOMIT and then every 6 months. Withdrawal symptoms. As with most anti-epileptic drugs, or AEDs, DIACOMIT should be gradually withdrawn to minimize the risk of increased seizure frequency and status epilepticus. Risks in patients with phenylketonuria or PKU. DIACOMIT for oral suspension contains phenylalanine, which can be harmful to patients with PKU. Before prescribing DIACOMIT for oral suspension to a patient with PKU, consider the total daily intake of phenylalanine from all sources, including DIACOMIT for oral suspension. DIACOMIT capsules do not contain phenylalanine. Suicidal behavior and ideation. AEDs, including DIACOMIT, increase the risk of suicidal thoughts or behavior. Patients treated with any AED for any indication should be monitored for the emergence or worsening of depression, suicidal thoughts or behavior, and/or any unusual changes in mood or behavior. Adverse reactions. The most common adverse reactions that occurred in at least 10% of DIACOMIT-treated patients and more frequently than on placebo were somnolence, decreased appetite, agitation, ataxia, decreased weight, hypotonia, nausea, tremor, dysarthria, and insomnia. Pregnancy. There are no adequate data on the developmental risks associated with the use of DIACOMIT in pregnant women. Based on animal data, DIACOMIT may cause fetal harm. There is a pregnancy exposure registry that monitors pregnancy outcomes in women exposed to AEDs such as DIACOMIT during pregnancy. Physicians are advised to recommend that pregnant patients taking DIACOMIT enroll in the North American Anti-Epileptic Drug (NAAED) Pregnancy Registry. Information is available at www.aedpregnancyregistry.org. This can be done by calling the toll-free number 1-888-233-2334 and must be done by patients themselves or their caregiver. To report suspected adverse reactions, contact Biocodex at 1-866-330-3050 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Please see full DIACOMIT prescribing information at diacomit.com.